Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is on all about accurate patient assessment upon initial admission, which is done by all our bedside nurses. Yes. I now may welcome our expert panelist, Ms. Martha ji, who is our former nursing superintendent and child development lead from one of the Hyderabad unit. Yes, I welcome you, Martha ji.
Thank you. Thank you once again. Thank you, Shanti, for giving me this chance. And a special thanks to management of Yashoda Hospitals for giving me a chance to join this webinar. Myself, yes, I worked for Yashoda Hospital 13 years. Now I'm the team lead in Child Development Unit. We deal with all autistic and special children. Thank you once again.
Thank you so much for your brief intro. And the second expert panelist is Dr. Professor Phibina, who is from Mother Teresa College of Nursing, from the state known as Chhattisgarh, the heavenly mountain with the lush greenery, and the from Kumhari, I guess. Yes, I welcome you, Phibina. Yes.
A very good afternoon to one and all present over here. I'm really thankful for giving us this great opportunities as one of the panelists. And I'm thankful especially for the Yashoda group of institutions and the hospital, and especially Ms. Shanti Bhattacharya, madam, for giving us this opportunity. Thank you so much, madam.
Thank you so much. And let us also welcome our beloved speaker, who is the smallest in the group, and her name is Ms. Riya Elsa Abraham from Yashoda College of Nursing, Malakpet, Sarvanagar. I welcome you. Yeah, Elsa.
Thank you, ma'am. Thank you for this wonderful opportunity.
Yes. And yeah, we are just going to keep this, session very, very time bound. And going with the first slide, we would like to understand from Martha ji, what is accurate patient assessment mean, which is done by all bedside nurses whenever patient comes to the hospital or transfer in. Yes, over to you, Marthaji.
Yes. Accurate patient assessment. This is the most important thing because everything depends on this. It refers to an accurate, thorough, and precise evaluation of the patient. And depending on his complaints, his illness, and physical, emotional, and social and psychological condition of the patients, they come to know. So I would say this should be done accurately for evaluating and further treatment of patients.
Yes. As rightly mentioned by you, yes, it has to be evaluated very accurately as well. Yes. Going forward, the insight from Phibina, like, is a stepwise pathway or clinical guidelines type tools or checklist for a patient assessment crucial for safe patient care? Yes, over to you for your insight.
My answer is yes, because it creates the personalized care plan for the patient, and especially it provides a pathway. It's make a roadmap to the patient for the individualized care. If I say, for example, if the person is having a diabetic or if he is not knowing anything, then we can say by the 3 Ps which he was suffering, like the excessive urination, excessive thirst. So we can allow the 3 Ps, polydipsia, polyuria, and polyphagia. So we can assess by this to the patient and advise the patient to go for a blood test, and for that we can analyze for their hyperglycemic point.
Yes.
Thank you so much, madam.
Yes, very relevant example you have provided. Yes, and this is for Ria's insight. Let me also understand what Ria, as a clinical student nurse, what she's experiencing. Yes, should nurses complete patient assessments within a specific timeline? I think yes, Ria, because this is a very challengeable question. I'm trying to understand from your point of view. Yes, yeah, over to you, Ria.
Yes, ma'am. The nurses should always complete the patient assessment within a specific timeline. So when it comes to the ward patient, the assessment should be completed within the first 30 minutes. And when it comes to the intensive care unit, it should be completed within the first 15 minutes. And when it comes to the emergency department, as in cases of the emergency patients, we should complete it as soon as possible for providing the effective care.
Yeah. So again, I would like to understand your insight. Sometimes we are not able to maintain or do this initial assessment within time. So what you think that nurses should be doing? Maybe nurses have 4 to 5 patients assigned to. Yes. What do you think? What should be done?
Yeah, ma'am. Sometimes it might be difficult, but we should never exceed this time. It's very much essential to be within this time and to complete this assessment within the specific time. So all the nurses should try to do that.
Yes, very greatly, as you said, the real practical experiences. Yeah. So again, going forward for Marthaji, what are the situations where right patient assessment and intervention to be done immediately? Like, yes, nurses do have their challenges, in the clinical scenario where
Clinical
patients are
setup,
all with
yeah.
complex, interventions in nature. Yes. So what do you, Marthaji?
Yes, certain emergency situations suddenly happens
Yes.
means then it is crucial. Like if you're in emergency department and suddenly patients drop is there in BP or vitals, and suddenly
Yes.
he starts sinking or he starts moving his limbs, and I mean sudden stoppage of respiration or
Yes.
deviation of his face, something like that. We just have to immediately act on it and
Yes.
rush him, get medical aid, send him to the emergency. Yeah,
Yes.
sometimes their conditions will worsen. We have to be so apt in, getting
Yes.
medical aid and ask for help immediately.
Yes.
Yeah.
Very great insight. Yes, going forward again, this is again for, I think, Maria. Yes. So this, we are trying to just show this checklist as well, because this is the initial assessment which nurses they do when they receive the patient. And, sometimes we experience or we see when we validate this, form. Yes. Should this be a real accurate, checklist? Yes, Ria, what is your point on the same? Yeah.
Yeah, ma'am. This checklist, we should never write any kind of mere information. The
Yes.
information that we are going to write should be always accurate. For example, a bedridden patient is coming to the hospital. So he might be having some pressure ulcer. So
Yes.
without checking that, without conducting any kind of physical examination, we are just mentioning that no pressure ulcer is there and we are going to admit that patient. But later, the patient's family might come and they might tell that after getting into this hospital, the patient got this pressure ulcer. So this kind of situations can happen. So always write only the true and correct statements in the assessment sheet.
Yes, as rightly you said, skin integrity, we nurses sometimes we bound to forget to mention it. Yes, as rightly you said. Yes, going ahead, if a patient is not in sound mind or confused or not able to talk or sick or may not be able to understand the language, how should nurses take the information? Yes, Phibina, what do you
Yes, we
know?
can get the Yes, ma'am. We
Yes,
can get this information by the keen observing to the patient and for the close relatives. And also we have to gather this information by the non-verbal clues, the facial expression, the body gesture of the patient, and by using a proper language towards the patient relatives so that they can easily, understandingly language, they can give us the idea how the patient was suffering and what is the main condition of the patient. We can directly ask the short and direct question and simple answer we can find from the patient side, so
yes.
that we cannot also harm the patient, not also harm the relatives and anybody. By the physical examination, by the vital signs, and by the laboratory findings, we can have this information in correct way. Thank you, ma'am.
Yes, as non-verbal cues are also very important. Yes, very great insight you have provided. Yes, and is accurate patient assessment crucial for delivering high-quality nursing care? Yes, because all the patients in the hospitals are, they are different, and their clinical states are, sometimes complex in nature. Yes, over to you, Mataji, for your insight.
Yeah. Yes. Yeah. We need to get accurate patient assessment because then only we can give an effective and personalized and
Yes,
safe care to the
yes,
patient. This is most crucial because all this depends on this solidly. It requires
yes,
strong critical, findings what they put it, and then according to that, the doctor,
yes,
yeah, and good communication skills and clinical skills, people will know that they are able to,
yes,
I mean, give correct treatment to the patients. Yeah,
yes. Yeah,
that's
it
how.
is a kind of
Because,
documentation which everybody
yeah,
can
because,
refer.
yeah, if somebody is allergic to something and it's not documented, and then something goes wrong, because somebody has not documented, and maybe
Yes.
patient would have missed out and the nurse would have forgotten to ask. So this is every column they should fill. Yeah.
Yes.
Check the patient and the attendant. Yeah.
Yes. Again, going forward, what should be an evaluation criteria of patient assessment? As we have learned when we used to initially write our care plans, assessment, intervention, planning, and evaluation method also is important, which we sometimes fail to do. Yes, how it should be like. Over to you, Mataji, again.
Yeah. That's the same. Like if they will get the correct information, maybe
Yes.
accurately it should be documented so that we don't miss out. There are so many columns. Just if the nurse doesn't check correctly what is asked and just guesswork, we're going to harm the person instead. So whatever they document should be, checked completely, and it should be
Yes.
correct. If they don't know, they can leave a gap. But if they just put something, everybody goes by that one sheet, overall picture of the whole scenario of the patient is there, because head to foot they do the examination and then they chart everything the patient says and the vitals, everything, including vitals, should be checked so accurately and charted. Sometimes I feel,
Yes.
you can do it manually as well to confirm both are good.
Yes.
Yeah, so that plays an important role if they will do it correctly, completely and accurate, and documentation is most important. Yeah,
Yes.
so that's what is important.
Yes, as rightly Mataji said, and we request everybody not to just start your care without assessing the patient, that too upon admission and initially when you receive the patient. Yes, going ahead, and yes, this ongoing assessment also should be done. I think yes. Ria, what is your insight on this? Yeah, over to you.
Yeah, ongoing assessment should always be done. So whenever one nurse is completing her shift and the nurse is leaving and the other nurse is coming, so this time the nurse should again assess the patient. So
Yeah.
in other condition, like when the patient is going for any kind of procedures or diagnostic evaluation like MRI scan or CT scan, in that time also assessment should be done. And when we are providing certain kinds of medication to the patient, we must understand the response of the patient towards that medication. So at that time also this assessment should be done. So whenever the patient's condition gets unstable or whenever the patient is being shifted from one ward to another ward or from the ward to the operation theatre, in these circumstances the assessment should be done.
Yes, and it is as she rightly said, it should be ongoing in continuation, right? Until the patient is discharged. Yes. Yes, the next insight we'd like to understand from Phibina, should nurses be given checklist? I mean, these checklists are like organized in an organized format and structured one so that nurses, memorizes and intervene step by step. Yes, over to you, Phibina, for your insight.
Yes, yes. Nurses must be given a checklist. It is a form of a structured, organized format because it
Yes.
helps not only for the reduce the medical errors. This checklist also help to prevent the omission of the critical steps in the procedures during drug
Yes.
administration or any other things. It also helps improve the communicative skills and the task and the standardization of the care, which, what, when, how the task has to be done. This will help the student nurses and the nurses to have a proper checklist. It helps for the patient safety also. We can have the
Yes.
proper cognitive task and anything we have proper evaluating, and we can have communicating skill towards this. So it
Yes.
is very important for us to have a checklist.
And all checklists should be very simple, so that nurses understands and they perform better care. Yes. Going ahead again, in spite of having these checklists and tools or pathways are already in place, but we still see few lapses, non-compliances, not done properly. Just did maybe when I asked a nurse, she did not know how to answer, or validation was not done. Like these are the contributing factors whenever we go to the clinicals. Yes, yeah. What you think? What should be done in this scenario? Yeah.
Yeah, ma'am. Sometimes lapses do happen. So sometimes when the nurse is asking the patient certain questions, the patient might not understand. In the similar way, what the patient is saying, sometimes the nurse won't be able to understand. Language barriers are there. So this language barrier is a primary factor of these lapses which is happening. And not only that, poor communication skills and also poor cooperation between the team members inside the hospital itself. So these
Yes.
factors can result in lapses.
Yes, very nicely you have pointed out, yes, a few communication barriers which you may experience. Yes. Do nurses feel good when the patient assessment is effective? I think, yes, Mataji, you would
Yes.
like to, yeah, really agree with
Yeah.
my answer as well. Yes.
Yes, they
Yes,
feel
over to
very
you.
good when the patient's assessment is effective, because they can build a good rapport with patient, and then when they see changes in the patient, they feel very nice. It boosts them up, it boosts their morale, and they feel confident. Yes, what we have learned, we have put into practice, and then they are recognized. They get recognition and trust from doctors, and saying that yes, this nurse is good, and it also reduces their stress.
Yes.
Then they have a patient satisfaction that yes,
Yes.
when they see some improvement, they feel nice. Patient
Yes.
is doing good. Yeah, and there are no errors. And once it is effectively done, everything is correct. So they are so sure that there's no errors from their end. They have done the
Yes.
work systematically, no complications will arise because they are giving their best. And when the outcomes
Yes.
they see, they're very happy. Yeah.
Yes, that is only one driving factor for all the nurses when they
Yes,
feel,
yes,
yeah, happy, as you rightly said. Yes. Yeah, very valid point you have provided. As yeah, now again, should student nurses, as we know, you're the able mentor for all your students, Phibina, and yes. So should student nurses start observing or practicing these tools while they are posted in clinicals? Maybe in few facilities they may not be allowed. Maybe in few facilities they are being asked to only observe the patients by not doing all this filling the checklist and all. What is your take on the same? If you have to start anything new, what would you do? Yes.
Yes. Yes, the student nurses should start practicing the relevant clinical tools under the
Yes.
guidance of the experienced mentors, especially the seniors. Senior one is very important in their clinical practices. Not only it helps to improve the skill, but also it bridges the gap between the theory and the practice. So what the
Yes.
student are learning in theory, it goes to the practice, and again it builds the confidentiality, it creates the competence towards the student. It have a mentorship, utilizing the proper mentorship help the students to have a proper clinical facilities and clinical practices in their clinical setting. So my answer is
Yes.
yes, the student has to go for their clinical practice
Yes.
tools.
I think we are very close to for the end of the discussion. Yes, but time is a factor. We have to end. Yes, going another. We have two more slides to be discussed with, and this is for Mataji again for your insight. What are the challenges? I think anything to
Yeah.
have. Whatever you start with the documentation or
Yes,
policies,
there are.
procedures, any SOPs,
Yeah.
we do faces a lot of challenges, and especially by the bedside nurses. So, what are the challenges they may face from not doing the effective patient assessment? Yes.
Okay, there are a lot of challenges actually nurses face. Maybe the workload is heavy,
Yeah.
nurse-patient ratio, they have so many patients, they cannot attend to everything, and sometimes they miss out. Maybe they don't have, sometimes if it's a junior nurse, not much
Yes. Yes.
experience, no clinical experience, she might be lacking in that, or
Yes.
maybe seniors will come around, so they are scared of that. They want to finish that everything in their time frame, and language could be a problem because they are not
Yes.
able to communicate with patient properly, or they're not heard properly, or they're not able to analyze whatever the patient
Yes.
said.
Yes.
Sometimes patients are very rude, or sometimes they're very
No,
uncooperative.
complex type patient. Yes. Yeah.
And then of course they are tired from their workout, and they are burnt out, and these are also challenges because they're at
Yes.
the end of the day, if they are not given their full and they're not satisfied, but still they're trying their best when it comes to many patients, right?
Yes.
And
Yeah.
overall, yes, and sometimes they're very good in their work, they may not
Yes.
know how to document it. So this also, they need all the skills, Maybe
Yes,
that's all the
yes.
challenges they face.
Yeah, very relevant, contributing factors you have provided. Yes. And the last insight we like to understand from Ria. And yes, this is for you, Ria. What practices should be inculcated to improve compliances or the practices? Yes, over to you.
So, ma'am, for the overall improvement, the first and foremost thing that we should do is to create a rapport with the patient. So, strong rapport creation will help us to overcome this problem. And active listening should be practiced. Whatever the patient is saying, the nurse must be able to listen to that attentively. And communication skills of the nurse should be improved. And while taking these assessments and all, we should practice it at the bedside.
Yes, learning
Yeah.
by doing and doing by learning is only one core fundamentals. Yes. Yes, that was very valuable session. I think the time is not enough. We like to talk more and more about this. Yes, but yes, I thank Ria, I thank Phibina, I thank Mataji for your valuable contribution, and
Thank you.
we'll further connect for more updates and more learning. And kindly share this link as much as possible for others to see and share. Yeah, thank you. We end the session.
Thank
Thank
you. Thank you so
Thank
much.
you so much, madam. Thank you so much.
Thank you.
Thank you. Okay. Okay.